You know, one of the real problems in medical practice today, whether that's dental, naturopathic, allopathic, whatever, is that we put ourselves in little boxes and we operate from there. Edward de Bono wrote a great book on lateral thinking and said that the definition of an expert is someone who knows more about the own hole that he is digging than anyone else knows about his hole. They're all busy off digging their other holes. It is truly a unique situation to have, especially an allopathic physician, because we're so damn arrogant as well as ignorant. It's so rare to have them actually cross the boundaries and begin to look at other aspects of interaction and physiology. In other words, how do we get sick, and how can that help us plan how to get better? And it's really marvelous when someone who has real training in allopathic specialty medicine, who can look at cardiovascular disease from a highly specialized viewpoint and say, wait a minute, there is something going on that's causing this in a very profound way that we can interrupt and interfere with. So the important part of this message is you're going to learn how to talk to patients who have problems or who could create problems if they follow conventional medical advice and reduce their risks for cardiovascular disease in the future. Is that important? Sure. The number one killer in our current paradigm, although cancer will soon pretty well put that to shame. But the important thing to learn about coronary heart disease, it's the same thing with strokes and gangrene and kidney failure and all these others, blindness. We have not tied together statistically the importance of this, but I think what we're looking at is the mouth is the principal part of the beginning of so many of our diseases. So, Dr. Levy, if you'll please come forward and share with us some perspectives from specialty training, specialty practice, and actually reviewing the literature. Unlike our Congress critters, he reads the bills before he passes them. Dr. Levy, thank you so very much. I appreciate it.
Am I on? Okay. No, okay. Well, it's a pleasure to be here, and I hope to introduce you to some new concepts that will not just be academically interesting, but can directly pertain to your practice, whether as a physician or a dentist, because one of the main messages that I want to deliver today is that there should be a whole lot more crosstalk and crossover between dentistry and medicine than there is today. Each side treats the other side like, not like they don't exist, but like they're completely separate and have nothing to do with each other. And of course, just being a member of this organization, you're very aware that so much disease does begin in the mouth. It'd be great if dentists and physicians all went to medical school, and if you choose dentistry, you become a subspecialist in dental medicine. That, to me, would be the most appropriate way to treat this situation long term, because not only is the mouth related to disease, there's not a part of the body that's more related to chronic degenerative disease than the mouth. There's a lot of references throughout the talk, and I end each reference with a 7 or 8 digit number. And if you just go to PubMed website, enter that number, and click enter, you'll go directly to the pertinent abstract and sometimes the entire article. Now, obviously by the title of the talk, I'm going to go into some detail on the relationship of the root canal treated tooth and other forms of dental toxicity and heart disease. But to get a better foundation on why that is the case and why it's pertinent, I want to present to you what I think is a very true and legitimate unified theory for the cause of all disease. And the cause of all disease, quite simply, is increased oxidative stress in the diseased tissues, the diseased cells. And I'm going to show you why different factors will cause different disease manifestation. But the bottom line is, in medicine and in biology, there's an enormous amount of complexity, but at times there's an enormous amount of simplicity. And this is one of those situations of incredible simplicity, because I've been looking for many years now and I can't find any disease process that this does not apply to. So it truly is, I consider it to be, even though I'm presenting it as a theory, I consider it to be a fact. All disease relates to increased oxidative stress, and increased oxidative stress always exists where there's a deficiency of antioxidants and/or an excess of free radicals. And in looking and trying to understand redox chemistry and antioxidation, that's where the literature on vitamin C really plays a big role. I think most of you know I've written a little bit about vitamin C. and it's not just maybe my pet subject, but it still never fails to amaze me. The more I learn about it, the more I see how its deficiency in different areas of the body directly relates to virtually all disease. Because wherever you have an antioxidant depletion, you have increased oxidative stress, and your most important antioxidant is vitamin C. So understanding the biochemistry of vitamin C, in my opinion, goes a long way toward understanding all chronic degenerative disease in general. Now, redox biology, reduction oxidation. Prooxidant. This is something that takes electrons or causes electrons to be taken away from other molecules, which is oxidation. Very important. All toxins are prooxidant or have a prooxidant effect, and that is why they're toxic. Antioxidants, such as vitamin C being the prototype, does the good things it does because it gives or restores electrons back to the oxidized molecules or directly to the prooxidants before they take electrons away from other biomolecules. So, extremely important point right here. A prooxidant and a toxin are usually one and the same, or they have the same effect. Because of this statement is solidly established in the literature, although not in the literature that they have in medical school or dental school, but in the literature. Because of the fact that a prooxidant and a toxin are one and the same, an antioxidant is a true antitoxin. And there's not been a single toxic process, toxic condition reported on in the literature that vitamin C or another antioxidant, such as alpha lipoic acid in the liver, but basically where a properly dosed antioxidant does not completely resolve the acute intoxication. A corollary to this, because when I first looked into vitamin C, I also looked into infectious diseases because, vitamin C did a great job on infectious diseases as well as toxins. Well, as it turns out, the reasons infections are so bad is that all pathogens induce increased oxidative stress. That's basically how they cause their destruction. Now, of course, with an infection, you could have other factors. You could have a physical space occupation. You can have the infectious process slowly eating away other tissues or organs, so you could have other ways in which they could harm you. But at the initial level, all pathogens cause their problems by increasing oxidative stress, and many of them also produce endotoxins and exotoxins. And so far, as I mentioned, all toxins against vitamin C has been tested. In the literature I reviewed, it was well over 100 that I looked at. And it never made sense to me until I finally realized that it never made sense to me how can one simple molecule so closely akin to glucose neutralize and resolve basically any type of intoxication you can come up with, no matter what the nature of the molecule, the size of the molecule, where it went. It just didn't seem possible until you realize the final common denominator is that all those toxins are ultimately toxic because they take electrons away from important biomolecules, aka increase oxidative stress. So, quick recap. I would assert then that all disease results from the relative presence and the interactions among and between pro-oxidants or toxins, pathogens, which I call here pro-oxidant providers, and antioxidants. So there's the simplicity. Now, how you treat a lot of disease, that's where the complexity comes in. Because even though there's this straightforward elegance about what causes disease, how to modulate and positively impact those factors, that's where the complexity of biology and medicine in dentistry comes into play. Now, another very common word now, not only in the medical and the dental literature, in the scientific literature, is inflammation. And inflammation, many people these days are saying, is at the root of a great deal of disease. Well, I'm going to tell you, it's at the root of every chronic degenerative disease. Because inflammation is nothing but a synonym for a focal area of decreased to absent antioxidant presence. So you can't have inflammation and have a full supply of antioxidants present. The only way inflammation can come into play is when antioxidants have not been taken in or have been consumed. Now, very interestingly, what happens in your body when you have an area of inflammation? Well, it's a signal to the immune system. Arguably, the most important thing that inflammation does is trigger a signal to your immune system to bring the important immune cells to that site of inflammation. And if it's just an acute insult versus a chronic insult, then the immune system can resolve the inflammation and everything's hunky-dory. Well, what's the first white blood cell, immune cell, that gets summoned to a site of inflammation? It's the monocyte, the macrophage. Now, guess what? The monocytes and the macrophages have over 80-fold, that's 8,000%, over 80-fold more vitamin C than the plasma. So they're literally little super concentrated pockets of vitamin C. So kind of interesting that inflammation, which is an area of acutely depleted vitamin C and antioxidants, the first cell that comes in is the one cell in the body that has the highest concentration of vitamin C. I would submit that it's sort of a feedback mechanism designed to get as much antioxidant presence at the site of inflammation as quickly as possible. Also, fibroblasts that eventually come in at sites of inflammation, depending on the tissue type, also bring in a large amount of vitamin C. So as I just mentioned, when the primary insult is self-limited, inflammation is great. It resolves the situation. But if the primary insult is chronic and just continuing to hammer a tissue and deplete its antioxidants and have a chronic inflammatory condition, then the inflammation becomes the disease. So, I mentioned before that a toxin is something that oxidizes or causes biomolecules to be oxidized, takes electrons away, nothing more. So how could you have so many different medical conditions arise from different toxins? Well, it's the nature of the toxin. Is the oxidative stress that's being induced, how long is it present? Where is it present? Is it present in certain tissues, extracellular, intracellular? Is it very mild? Is it very severe? Combinations of all of these things. And also, the nature of the toxin. That's a biggie right there. Nature of the toxin being whether it's fat or water soluble, or some actually are fat and water soluble. Is it physically large molecule, small? Does it have an ionic charge or not? What's its unique molecular structure in size in stoichiometry? How readily does it oxidize a biomolecule by virtue of whether or not it fits with it? Does it have a tendency to produce oxidative chain reactions? Does it tend to target, due to its unique chemical configuration, specific enzymes, amino acids, or antioxidant enzymes? I mean, think of the case of cyanide. I mean, cyanide will kill you in a few seconds to a minute. It's not because that toxin is more effective at taking electrons away than any other toxin. It's really just about the same, but cyanide, by virtue of how it's delivered, inhaled, getting into the respiratory chain reaction, and preventing the delivery of oxygen to the tissues, you succumb very quickly. But the final common denominator is still taking electrons away in oxidation. Some toxins, mercury and fluoride and other things, accumulate. And over time, you can have a toxic effect that's not necessarily primarily due to oxidation, but just due to the physical mass that the toxin is taking place in your body. If it's physically present and not allowing certain biomolecules to interact, that will be a toxic effect as well. How effectively is it chelated? How effectively is it excreted? Some toxins look like other biomolecules and can incorporate and substitute for those biomolecules. So these are all things that give the full range of clinical expression for different syndromes, even though, and obviously I'm hammering on this, even though the final common denominator is oxidation. So, with all, what did I do? Oops. I want to go away. There we go. So with all this in mind, this is what I've put together to what I consider to be the most significant causes/promoters of chronic degenerative disease. Number one, far and away, and this is obviously why we're going to come back to the root canal. Number one is infections. Okay? Number two are known toxin exposures, and whether or not they're acute or chronic, and whether or not they accumulate. Number three, and I could go into a big aside on this, but I don't want to take too much time away from this, except to say that although each one of these things, iron, calcium, and copper, is essential to life, These same three metals are also essential to death. Okay, they're double-edged swords. And you only need them in precise amounts in your body, and when you get beyond that amount, their benefit turns into toxicity, sometimes severe, sometimes fatal. The one that most people have a pretty good idea these days that you got to be easy on your iron and your copper, although I will tell you, never supplement copper. You've got plenty of it, and all you're going to do is increase your oxidative stress if you supplement it. No supplementation with copper, period. Iron. Never supplement iron, even if you're a menstruating woman, unless you have, on a blood test, an iron deficiency anemia. If you don't have an iron deficiency, if you have a normal blood count, you've got enough iron in your body. And then the one that causes a lot of angst with the ladies, justifiably so with all the propaganda that we've been fed for decades now, is calcium. It's beyond the scope of what I'm going to talk about here today. It's covered extensively in my book, Death by Calcium, and we have a situation where anybody here can download the ebooks for Death by Calcium, The Toxic Tooth, and Primal Panacea if you want that. And all the documentation is there. But I will just tell you that everybody in this room has an excess of calcium. Not in your bones, but in your body. Okay? And the degree to which you're healthy or regain health is the degree to which you can mobilize the excess calcium out of your cells, which is the primary reason that you have increased oxidative stress inside your cells, and the primary reason that you have malignant degeneration of any particular cell. Dietary toxin exposures, constipated gut. As we'll talk about with the root canal, most sources of chronic infection do come from the mouth, from the oral cavity. However, you know, some people have a pretty good mouth and they're still having problems with situations that are consistent with focal infections. Something's seeding microorganisms and toxins from somewhere. Well, one that gets overlooked to a great deal is the constipated gut. Okay? If you got to be pooping at least once a day, preferably twice a day minimum, to have that type of bowel transit time so that digestion is always the predominant factor over putrefaction. Because the moment everything slows down, you start getting more rotting than you have digesting. Okay? Why some people can walk into the bathroom and nobody else can go there for 45 minutes, and why others can walk in right after. I mean, we all have family members. We know that story. But it's not normal. Slight malodor is normal. Overwhelming odor intoxication is not normal. That's called rotting. Okay? And the Clostridium that is common in the gut, these are the same type of anaerobic bacteria that produce the same type of toxins that we're going to talk about with root canals. So a really constipated gut, I would submit to you, is like a gastrointestinal root canal. So it's very important. And how you eat. I cover this a little bit at the end, but since I've opened Pandora's box here, let me just follow this up a little bit. Is obviously the better food you eat, the better off you are. However, one main proviso, more important than whether or not you have a perfect organic diet or whether you go to McDonald's, is how well you digest it. Organic food digested improperly is going to be more toxic to you than the worst selection of foods perfectly digested because of the toxic byproducts of poor digestion. And this gets into the whole point about food combining, which again is beyond this. But the only way you'll ever achieve proper digestion is paying attention to food combining principles, I'll say that. And then finally, hormone imbalances. And I'm going to address this in a little more detail toward the end of this presentation because it's just come to my attention. It's old information, but it's brand new to me, as to the fact that there are incredible mitigating factors of a proportion that I would never have suspected in terms of determining the clinical impact of a root canal and other focal infections on your body. And I'll give you a hint and tell you it has to do with thyroid status. It's kind of like I talk to people, doctors, lay people, physicians, dentists, and everybody knows, for example, vitamin C is good for you. Oh yeah, I know vitamin C is good for you. I take 500 milligrams a day. They know it's good, but they don't know the whole story. Well, analogous to that is everybody knows it's good for you to have a normal thyroid status, but I've got news for you. You've got no clue how important it is, and I'll get into that. Okay, so my treatment principles for all chronic degenerative diseases are to prevent or minimize the new toxin exposure, to eradicate acute and chronic infections, to eliminate, detox as best as possible, accumulated toxins in as non-toxic or minimally toxic a fashion as possible. Remember, detoxification to some extent is always retoxification. Okay, so you need to protect your immune system when you're mobilizing and excreting toxins. Very important, getting close to number 2 or number 1 or a co-number 1 now, is normalizing critical regulatory hormones, sex, thyroid, adrenal cortical. I mean, all the studies are out there. Low thyroid function increases all-cause mortality. Low estrogen levels in women increases all-cause mortality. Low testosterone levels in men increases all-cause mortality. Not just cancer, not just heart disease, all-cause. I'll give you a hint. It's also because all of those things relate to calcium metabolism, which is the underlying feature of increased oxidative stress in all your cells. So, then number 5, you want to optimize nutrient levels and antioxidants. And let me say, a nutrient or a quality food, the only thing that a quality food or a nutrient does ultimately is at the molecular level deliver an antioxidant effect. So a molecular nutrient, if you will, is an antioxidant. And finally, it's very important not to be too completely against mainstream medicine on general principles. Is they don't have a lot of good things, but they do have some very important prescription medicines. When, I mean, it upsets me, and I feel bad for people and physicians and dentists when they go to a meeting and they come back with some sort of holistic program for high blood pressure. Well, I just got to, well, let me tell you, with very rare exception, if you've got high blood pressure and you don't get rid of what's causing it, which is usually excess toxins or infections somewhere in your body, you damn well better take your blood pressure medicine, because you will die of a stroke or of a heart attack long before your time if you think just by modifying your diet a little bit or cutting back on this, you're going to control your blood pressure. You'll make it better. Those are mitigating factors, but someone with established high blood pressure of a significant degree needs the medication. We got to give mainstream medicine that one. Now, what I call the common toxicity of the modern mouth. I have sort of three categories. We have scientifically flawed procedures, the root canal and the implant. And I'm going to say not all implants are bad. I'm going to go into that in a little bit detail later. But these, especially the root canal, always assure the continued presence of infection in the teeth and gums. Also, number two, dealt a lot with mercury and other things. Obviously, everybody knows that there's intrinsically toxic materials, and that's a toxin exposure. And number three, very, very much less appreciated, but very important, chronically infected but normal appearing tonsils. And I'll discuss this in a little more detail later. Very important information, especially when someone with a significant condition, heart problem, cancer, you've done everything you think there is to do, addressed every issue, addressed every source of infection, and they're just getting worse. Bring these thoughts back to mind. So, the sources of dental toxicity: root canal, infectious and toxic; periodontal disease, infectious and toxic; cavitations, toxic and low-grade infectious. They have pathogens in there, but they're generally sparse, and they're not actively growing as they would elsewhere in the body. Toxic dental materials, and implants when improperly placed. So, the root canal treated tooth. In the book that Dr. Kulatz and I wrote, The Toxic Tooth, we had written one about 12 years earlier than that called The Roots of Disease, but we rewrote and put a new book, The Toxic Tooth, because so much information has hit the literature in the last 3 to 4 to 5 years that just puts everything that we initially talked about and that Dr. George Meinig and Hal Huggins talked about back in the day. Now we have the scientific foundation to go from suggestion to fact. So, the root canal treated tooth is what we call a fatally flawed procedure, because the nature of the procedure is to take out the pulp, apex. Usually someone comes in with pain. Usually the tooth is already infected, and you aim to make them go home pain-free. And so in order to make them go home pain-free, you have to evacuate the pulp, in which case you evacuate, most of the time, the nerves that are carrying the pain that they have. But it's sort of like treating a boil on your arm by cutting all the nerves going to the boil so you no longer feel the pain, but you still got the infection. At most, the best technically done root canal will debulk an infection. It will never, never, never sterilize the tooth. Dr. Weston Price tried many times to sterilize root canal treated teeth outside of the body. Outside of the body. And he used chemicals that couldn't possibly be tolerated in the mouth. He couldn't sterilize them. He actually, to a limited degree, autoclaved them. He couldn't sterilize them. There's no way you're going to autoclave a tooth inside somebody's mouth, and it wasn't really effective when it was outside the mouth. So, the converse of this is to remember that it's the only normal state of the tooth is for the pulp to be sterile. There's no such thing as a normal tooth that has any pathogens inside it at all, even if they're not actively multiplying. Okay? Now, most of all, this is, I guess, more of a slide for the non-dental practitioner. You all know the routine. Interestingly here, though, almost uniformly, you always have the little periapical abscesses, because most of the time, and this is sort of the link with periodontal disease of an advanced degree and an infected tooth, is although you can certainly have advanced cavities that eventually breach the pulp. It'll obviously affect the pulp. Probably most of your problems developed with people that have gum disease, and then eventually you get the migration of the pathogens in the mouth down toward the tip, and then you get a re-entry into the pulp to give you your additional infection. So, and of course, the endodontist, he calls the procedure success whether or not the pain is eliminated, and if there was an X-ray indication of infection or abscess, if that's gone, or if it's significantly diminished. Well, an infection is an infection, an abscess is an abscess, and we'll see too that a lot of y'all are now getting the 3D technology in your X-ray, and when you become really accomplished at that, you're going to see radiolucent areas around all root canals, okay? Not just a handful. And what? That is dead, yes. So, you all know what a root canal looks like. Look at how all these spaces here, you can already see basically the gum disease that predisposed to this in the first place. Now, less toxic but still toxic is the traumatized tooth. You basically kill the tooth, and it was never infected, but once the tooth is dead, it will become infected as well. It may not have the total negative impact as a large back molar that you root canaled, but especially if somebody's having problems and they have a dead tooth, even though it's been preserved well, you have to remember that could be a source of great toxicity too. Now, the reason why, one of the reasons why a root canal can never be sterilized is, first of all, you get the, and we have nice pictures of this in the book. They have a great electron microscope pictures where you can see the bacteria lined up single file inside the dentinal tubules. It's very impressive. And sometimes we just think the immune system is going to do things for us when in fact we've taken away all its ability to do it. Immune systems are real cells and they require physical access to what you're going to. So, you know, once you take out the pulp, you not only take out the nerves and the blood supply and connective tissue and all the matrix upon which the immune and the immune system cells can migrate and get to something. Okay, so immune system needs access in order to work with a infection. The same reason for antibiotics. Now, this is particularly maddening to me, and to Bob Kulatz, who wrote the book with me, is there's so many physicians and dentists who think if they stick a laser inside something, it's going to sterilize it. Remember, a laser sterilizes only what's directly in front of it. It doesn't sterilize at a 90-degree angle. And it doesn't even sterilize at 5 to 10 degrees off to one side or another. But you put a laser down a tooth, and then the whole tooth glows. And you just sort of get this emotional feeling, well, the tooth is glowing, the tooth is being sterilized. It's not being sterilized any more than if you flip the light on in the room. That's scattered light that's making the tooth glow, but the only what's directly in front of it will be sterilized. Okay. Now, the good Dr. Huggins and Dr. Boyd Haley, got together on this 18, 19 years ago. And Hal got a large number of dentists throughout the country to submit their extracted root canals to Boyd at the University of Kentucky. And if there's such a thing as a non-infected root canal, it's yet to be identified. Yet I've talked to Boyd at great length about this. At one point in time, they'd had over 5,000 consecutive extracted root canal treated teeth. 100% had pathogens and highly potent pathogen-related toxins. 100%. And for somebody that says, oh, well, maybe it got contaminated as it got pulled through the mouth. No, they also took a whole bunch of orthodontically extracted teeth to allow space for the teeth to grow in, and all of these showed no toxins or pathogens. Also, it's very interesting, too, to think about the technique that Dr. Haley did in his test. He had to dilute the toxins out to a point where they could be measured. He would initially drop the tooth in a little vial of water for about an hour or so, and then take the tooth out and put it in another one. And it wasn't until he got to the third vial that he had diluted the toxins to a degree that they could be measured. Also is the array. I mean, root canals have been found to have fungi, viruses, and over 460 different types of bacteria. Which also brings into play the fact that although the procedure is the same across the board, whatever flora you have in your mouth and any other infections going on, basically every root canal is going to be a little bit different in regard to its toxicity. It's not uniform. And for that reason, and the reason with the thyroid that I'm going to talk about in a bit, not everybody that has a root canal is going to have a heart attack. But just about everybody that has a heart attack is going to have a root canal. Now, in examining this, they looked at root canal treated teeth, and they found endotoxins in this one study in 30 of 30, another one in 21 of 21, and then in another one that even looked at what they considered asymptomatic, whatever the heck that is, they found the DNA of bacterial pathogens in 34 of 34. So, to reiterate, finding a sterile root canal treated tooth does not exist. If it does exist, and I'm not saying it does, it would be like 1,000th of 1%. The degree of toxicity, this was something that Boyd Haley determined early on, because in his assay he would look at the very dilute specimen, not the initial, but the very, very dilute specimen that soaked the tooth, and he would often find toxins that, when measured against 5 critical human enzymes involved in energy production, that the toxicity by that parameter could be 1,000-fold more toxic than botulism. And botulism these days or botulinum toxin, is still considered by mainstream medicine to be the most toxic substance ever identified. So they haven't been looking in all the right places. Now, I say extraordinarily surprising, at least it was to me. Maybe it'll be to you too. But of all places, I believe it was the Journal of the American Dental Association, they found that individuals who reported having root canal treated teeth were more likely to have coronary artery disease, period. And I got some more studies on that a little bit later, but I wanted to throw that out right there. Now, the tonsils. Tonsils are, of course, immune structures, designed to help you deal with infection, process it, deal with it, manage it, and recover. Well, the problem with tonsils and root canals is the tonsil is a wimp and the root canal is Mike Tyson. And once you've had a root canal in on one side of the mouth, I can't give you a statistic because it's not been studied in that fashion, but I'm going to tell you that the vast majority of the time that there's been a root canal present on one side of the mouth for more than a few months, much less a few years, the tonsil on that side of the body, the ipsilateral tonsil, is trashed. It's become chronically infected to the point that it'll never recover. And I'll go into this right now because Dr. Joseph Issels in the 1950s ran a cancer clinic in Germany for basically metastatic advanced cancer patients of all variety that would finally come to him after mainstream medicine had done nothing and pretty much gotten all their money. And Issels did two things before he did his, turned out to be an immune vaccine protocol, in which he'd immunize them against their own cancer cells. But what he always did, he had a great response too. I don't want to emphasize that. But at a time, 1950, and you all probably know these statistics better than me, there were being vastly fewer root canals being done back in the 50s than there are now. But in the 1950s, 97% of these advanced cancer patients had one or more root canals or other infected teeth. 97%. So this protocol always involved removing those teeth, and he rapidly realized the tonsils were always infected, even though they appeared normal. And every time he got a tonsillectomy, he'd come out, they were infected, and then with that dental toxicity taken out of the body, then those patients were ready to respond vigorously to the rest of his protocol. Now, this really hit home to me about 2.5 to 3 years ago. I was out in the yard with my little dog, and some big dog in the neighborhood started chasing it, so I had to chase the big dog. God, I took about 4 or 5 rapid steps, bonk, chest pain. I'm a cardiologist. I said, oh shit. I walked very gingerly back to the house, was short of breath, sat down for 5 minutes, and it gradually went away. So I said, okay, what you got to do now? Well, I have to add that, I'd been tracking my blood work for some years, and for about the prior 10 years, my CRP, C-reactive protein, was always elevated. 4, 5, 6, really horrible. A C-reactive protein correlates to inflammation, infection in your body pretty well. And also, the higher your CRP, logically, the greater your chance of heart attack. And I had done so many things, taken so many supplements. I'd given myself 100 grams of vitamin C IV every day for a week to see if I could knock it out, and the CRP would dip down a little bit, and then a few weeks later be back up again. And I had read Dr. Issels' book, Cancer, A Second Opinion. Fascinating book. And I said, you know something, Levy? That root canal you had 20 years ago that's been out of your body now for 18 years since Hal Huggins took it out, that trashed your tonsil. So on that basis alone, I called my ENT doctor and lied in my teeth. I said, I am so sick and tired of having tonsillitis, I can't stand it. I've never had tonsillitis in my life. But before I called him, I looked up on the computer to find out what the indications were for tonsillectomy. So I had to make sure he didn't say, oh, well, wait till you have it 2 or 3 more times. So I said, this is about my 8th bout in about 3 years, and they're finally settled down now, and I want them out before anything else happens. Oh, okay. I mean, as long as you give them their reason, they're a surgeon's happy to operate, so. So I went, outpatient procedure, and he came to see me after it was all done to do his little post-operative check. And I said, Jimmy, how'd everything look? And he said, well, that's really funny. Funny that you asked that. I said, how's that? I mean, I didn't bait him or anything other than just asking him that. And he said, well, when I grabbed your tonsil on the left, now let me say, he said, my tonsils look completely normal. Maybe a little bit enlarged, but completely normal. He said, well, when I grabbed the tonsil on the left with the tongs to start extracting it, pus started coming out. Now, the root canal had been out for 18 years. The point being is, once tonsils have been overwhelmed, they lack the capacity to heal themselves. The previous meeting I went at, the IABDM, they mentioned something I never heard of before, and maybe it's a possibility if they start, and that was of getting some sort of resolution of tonsils with direct ozone injections into the tonsils. That might be a possibility. Short of a tonsillectomy, I can't tell you yet, because we just don't have enough information. He also mentioned, and this blew me away too, that direct ozone injections into a cavitation can sometimes regrow bone. That really amazed me too. So at least some things, some vistas are opening up, and we're getting some new opportunities to deal with this. Because I got to finally say, the tonsillectomy was the worst experience of my life. My God, I'm glad there wasn't a loaded gun in the house, or I'd have ended it all. That's another story. So I'd never take lightly the idea of an adult getting a tonsillectomy, but let me tell you, if you've done everything, the mouth is clean, and there's still abnormalities in the blood work, and there's clear symptoms of evolving disease from focal infection like heart disease, you should give it a consideration. Or at least give the patient the options and say, I can't tell you whether this is going to help or not, but here's the story, you decide. Oh, and the CRP dropped back down normal immediately after that. It was down to 1.5. Yeah. Yeah, it's an important part of the story, too. Okay. Now, we've known for some time periodontal disease is an important independent risk factor for coronary artery disease. A lot of different articles you could cite there. Now, I want to throw this out because I've had a great deal of success with this. Dr. Kulatz has had a great deal of success with this. Lots of people do lots of different things for periodontal disease. What I'm going to tell you is try this first, and you're going to be amazed how many times even advanced periodontal disease starts resolving and healing up within a few weeks to a few months. And that is the good old water pick or another water irrigation device, 1 to 2 large cupfuls, and 1 to 2 tablespoons of 3% hydrogen peroxide. I've had one person who had each tooth, you have your nice little gum line. Well, she was flat line, between each tooth, just really, really advanced. Within 2 weeks, she was growing brand new periodontal tissue up in between her teeth. Now, I'm not giving it to you as a 100% cure-all, but a lot of this stuff I would do first before going through a lot of the extensive mechanical manipulations and scaling and this, that, or the other. I mean, there's a place for all of it, but this is simple and easy, and you'd be amazed in so many people, especially those with minor periodontal disease, but I would suggest to you that even ones with major periodontal disease, you could get a great deal of healing when you deliver that the hydrogen peroxide very dilute under pressure with warm water. Dental implants. Okay. Dental implants cause a lot of toxicity. We saw a lot of neurological patients with HAL, and many of them had infected implants. But, as you all well know, how are 99% plus of all implants done these days? They're done either the same day or within a few days to weeks of the extraction taking place. Okay? So, you start the whole process in an area that would have otherwise evolved a cavitation. So, if you do, especially in the case of, let's say, an extracted root canal, a very good cleaning, get all the infected bone, heal in good solid bone, and 6 months later, do your implant, and then make sure your patient is extremely fastidious about gum care, because that's the main reason why implants fail is you don't ever get a good gum seal around the implant due to persistent low-grade infection. But manage the gums well, heal in good bone, and I won't say it's a non-toxic entity, but it's a minimally toxic entity. And also, relative to the root canal, an implant done like that will never cause you the same problem as a root canal because of the delivery system. The implant, if you put it in, like I said, is just sitting there. It's got bone around it. The root canal is plugged into the lymphatics and the venous system, and every time you chew on it, you squeeze out the toxins and the pathogens in the same fashion as if you did a hypodermic injection. Okay? All right. Now, let's get into the pathophysiology of coronary artery disease. Let's start with this. Right now, even in the mainstream medical literature, they acknowledge that inflammation, which, what did I tell you? Inflammation is nothing but vitamin C deficiency, antioxidant deficiency. Inflammation is now accepted as the primary cause for initiating and evolving atherosclerosis, and atherosclerosis is now considered by cardiology to be a chronic inflammatory disease. But they seem to lose their curiosity there. They don't seem to want to know or want to analyze, why did the inflammation develop? Just decided to develop one day. Well, in coronary artery disease, when you get this deficiency of vitamin C, you have inflammation, and then you begin the degenerative phase of atherosclerosis because the ground substance around the cells, which is normal, like a gel-like consistency, when you lose the vitamin C, the proteoglycans stop their cross-linking, and the gel-like consistency becomes loose and watery. So you lose the physical support of these cells, and at the same time you lose that physical support, that endothelial layer also starts to become more permeable to all the atherosclerotic agents that are circulating in the blood. And then once that starts, and once that inflammation then calls in the monocytes that have the high amounts of vitamin C, then what's happened is the proliferative phase. And that's where you just start to build the plaque, and the plaque will continue to build if the initial cause of the inflammation is not addressed. So that's why atherosclerosis is still considered, although it's not true, is still considered to be a disease that can't be reversed. I guarantee you, you can take 50, 60, 70% narrowings in the coronary artery, and I can give you a protocol where greater than 90% of the time, 6 months later, those plaques are either going to be gone or reduced by 50 or 60%. Okay. So, It's like layers of the onion. Cardiology sees this outer layer of inflammation, but they don't want to look at the one layer underneath it to figure out why the inflammation is there. Pathogens with their associated toxins, I have it here as major, but I'm going to tell you it's the entire reason for chronic inflammation at all stages of atherosclerosis. You just don't develop atherosclerosis for no reason at all, or because you're unlucky, or even because you have a positive family history. Those things set the stage for atherosclerosis if the infectious agents come into play. We've already known of periodontal diseases linked to atherosclerosis as well. Now, look at this. They've now developed some very refined DNA testing, polymerase chain reaction testing, where they can pretty much elegantly identify DNA in very tiny amounts and know where it originated. The DNA typical of oral pathogens has been identified in the coronary atherosclerotic plaque. Also, when they do procedures called atherectomy, which is where they roto-root out a narrowed area and then analyze what they roto-rooted out, they've identified over 50 different species of bacteria by this PCR DNA testing. Now, here's the smoking gun. I must take my hat off to these researchers in Finland to have the brilliance to do this, because it's kind of stunning that this study was even done, much less thought about, much less put an idea in their heads. But they're at a facility in Finland where they also have an active clinical area where heart attacks are being managed. And I guess it's been so long since I've been a mainstream cardiologist, I didn't even know they did this. But some patients now that come in with myocardial infarctions, of course I did know that they form an acute blood clot, usually a platelet clot that forms on top of an erupted plaque or a largely obstructed plaque to completely occlude the artery. Well, this group, their cardiologist sucked out, aspirated the blood clots out of these acutely blocked arteries in patients that were having the acute myocardial infarction and analyzed the blood clot. The DNA in these blood clots that were aspirated from these patients with acute myocardial infarction, of 101 patients, nearly 80% had DNA typical for root canals and 35% DNA typical for periodontal disease. Also, the total amount of DNA, think about this, found in the blood clots was 16 times higher than present in the arterial blood. Stop using the words correlation, link, association. This is cause and effect. There's no other logical way to put together this information except to say that you got a large amount of these pathogens and their associated toxins coming in, and at a certain point in time when the situation is susceptible, the blood clot forms. And the blood clot forms because of the pathogens. I mean, you don't form a blood clot and then suddenly out of nowhere get this huge concentration of organisms. Okay. Very interesting. This same group looked at, believe it or not, post-mortem heart examinations of patients with coronary artery disease. And in the undiseased heart, you have a small amount of pericardial fluid surrounding the heart, inside the pericardial sac, to sort of lubricate the contractions. Well, they examined the pericardial fluid in the same way they examined these blood clots, and they found that the DNA typical for the endodontic pathogens was present in that pericardial fluid, and the worse the coronary artery disease was, the higher the concentration of these pathogens. They did another one. They looked at cerebrovascular events, and they found that root canal-related bacteria were found in nearly 60% of patients with ruptured intracranial aneurysms. So, I mean, it's just seeding it everywhere. As I mentioned, root canals have a perfect endogenous delivery system. You know, you chew on them, and you all know how high a pressure you can develop between clenched teeth and chewing teeth. And you just squeeze it out, just as if you had a syringe and was injecting it straight into the lymphatics or straight into the venous system, both. Because, I don't have a chance to go into this in any detail, but I'll tell you that I even communicated with this researcher in Finland, but I don't think it's going to happen. I said, wow, it'd really be great if you could check malignant breast lumps for this same profile of pathogens. I bet it's going to be in the 90% plus range, because it's the shared lymphatics, and you look at thermograms, so you can see this on individuals with thermograms that are getting problems. You can see the streaming of the lymph straight from the mouth on down into the chest, into the breast and armpits. There's a direct connection. So, you have clinical variability of toxic impact. Okay, all root canals are not created equal. You have a variable pathogen content, a molar versus a front tooth. And a front tooth you're not going to chew on. You're going to bite into something, but you're going to grind on your molar, so you're not going to be generating a lot of impact with your front teeth. The variable degree of periapical infection, how long it's been in the body, how many different teeth there are, and the degree of associated periodontal disease. So these are all factors that are going to come into play. And I mentioned about the 3D X-ray examination, and you can really confirm the infection in so many of these teeth. I would say for your own protection, it would be good, whatever you charge for extracting a root canal, add a pathological exam to that charge and document in your chart the chronic infection that was present after the tooth came out. I mentioned this about Dr. Issels, and that's his book I was saying, Cancer: A Second Opinion. Okay. Getting short on time, so you can have the whole presentation, but there's a few things I want to emphasize to you before we get around to it. Now, yes, see, when you use 3D X-ray examination, you can see over 90% of the time radiolucent spaces around a root canal. So, 3 different groups, Kaplan, Joshipura, and one other. Basically, they decided to do a statistical study, and they showed that, and that was a quote, those with a greater self-reported history of root canals were more likely to have coronary heart disease than those reporting no history. Basically, translation, if you have 1 or more root canals, you have a greater chance of heart attack, period. This should be part of the informed consent. I mean, I'm not saying eliminate or ban the root canal procedure, but it needs to be part of the informed consent. Dr. Kulatz and I wrote our book with the idea that it's never good for a physician, for a dentist, for anybody to tell a patient what to do. Don't tell a patient you got to get the root canal taken out. Give them the book or parts of the book. You read it. Here's the information. You make your decision and come back to me. So, how does all this interact with other traditional coronary artery disease risk factors? Inflammation, cholesterol, high blood pressure, diabetes, smoking. Well, I told you what inflammation is. That's really the same thing as vitamin C deficiency or absence, and always allows the seeding of the oral pathogens. Cholesterol is not innocuous. Cholesterol will accelerate plaque growth. It will not initiate it. Okay? Cholesterol will never start developing a plaque if the endothelium is healthy. Okay? So, decreasing very high levels of cholesterol, yeah, that will decrease your chances of a heart attack. but not as reliably as you'd like to see. And also you put yourself at risk of other stuff. So when you take statin drugs, you got to remember cholesterol is a natural antitoxin. It protects against toxicity. The higher your toxins are, the higher your cholesterol goes to protect you from that toxicity. When you arbitrarily knock the cholesterol down without knocking the toxins down, guess what? Many, many, many studies have shown in this fashion, the lower your cholesterol goes, the greater your chance of cancer, period. Pritikin, who developed his Pritikin diet, had a phobia against heart disease, and he had a cholesterol in the high 300s, and he vegetarian dieted himself down to a cholesterol of 100, but the rest of the story is he then got leukemia and died. Cholesterol is good. Butter is good. Eggs are good. High blood pressure. High blood pressure plays a big role because it helps seed the blood vessels. I mean, the higher pressure you have, the easier it is to initially get pathogens and toxins to take. Diabetes, you all know that there isn't a diabetic with normal gums. Okay? And gum disease is always going to be an accelerant in getting these conditions. Smoking, same thing with the gums. Probably even more so than the diabetes. Now, bad luck or wrong dental procedure. There's so many internists, cardiologists. They will really tell you, they might not use these words, but this is what they're thinking. You're 55 years old, you got a family, you've been working hard, you've been running your marathons, and you get your heart attack. Poor bastard's just unlucky. Not the case. You can find the reasons for this. Okay, now, I didn't get all this information in the presentation for you, but very, very important. This stuff kind of blew me away. It's not going to change anything I said, but it's going to modulate it to a great degree. Okay, you reverse coronary artery disease, you lessen new toxins, you eliminate old ones, you optimize antioxidants, and you restore hormonal balance. Okay, we've gone through the root canals. And remember, not only with heart disease, but with cancer, never, whether you're approaching it from the mouth or approaching it from the physician's approaching it, you've not really done the best thing for your patient until you tell them an excellent reason for you not to get over your cancer is leaving the root canal in your mouth. Okay? Told you about no calcium. However, concentrate on magnesium, K2, omega-3, antioxidants, lysine, vitamin D3, and judicious thyroid replacement. No iron or copper. Eliminate stored toxins. Detox is retoxification. A very good way to get rid of toxins in a non-toxic fashion is a far infrared sauna. You get rid of the whole spectrum. And you also sweat out iron. They say you can't get rid of iron. They're wrong. You can sweat out iron very easily. Young aerobic athletes routinely, through their sports season, will actually have exercised themselves to an iron deficiency anemia by the end of their training season. Low testosterone. For testosterone, for estrogen, the important concept is document not low normal, but document pathologically low levels. Don't treat low normal levels. Treat low levels. And shoot for bringing them back to the mid-range to slightly low normal level. Don't shoot for a high level of restoration. I mean, 75 and 80-year-old men can use some testosterone, but you give them a lot, it's like putting rocket fuel in a Model T. That just doesn't work out. And will it give them a heart attack? Yeah. But getting testosterone on board at a low dose gently will also prevent the heart attack. So you can't ignore it. Sex hormones, same thing. Okay. That's my little thing. Low, slow, and bioidentical to reach a low normal to mid-normal range. Okay. All right. Thyroid hormone. I got this information from Dr. Broda Barnes and Dr. Mark Starr. And Dr. Barnes reported on 1,569 patients that he treated with thyroid hormone, and he very specifically, intentionally did nothing else. He didn't change their diet. He didn't tell them to stop smoking. He didn't tell them don't go to the dentist. He didn't tell them anything, okay? And he followed them over a 20-year period, and they were being treated with desiccated thyroid. Out of 1,569 patients over a 20-year period, only 4 of them had heart attacks. Now, at the same time, they have this thing called the Framingham study where they looked at a comparable age population, and that many people being followed for that period of time, there should have been 74 heart attacks. All he did was adjust the thyroid status. Furthermore, in 62% of these men were smokers. Big. 4 out of 1,500 had heart attacks. And a large group of them stopped taking the thyroid hormone, and 30 of that group subsequently had heart attacks. Now, is a root canal bad for you? Sure. Can a root canal cause a heart attack? Sure. However, it appears, much to my amazement, that normalizing your thyroid status is an enormously, not minimal, enormously protective effect toward letting infections anywhere in your body take hold. Because, I don't know, 1,500 people in the 1970s, how many of them had root canals? 20%? 25%? I don't know. Now, practical point there, and this is the problem with thyroid, is the thyroid hormone studies are nothing short of worthless. Okay? TSH and T4. Part of the reason is these thyroid tests really just look at extracellular thyroid function. And we're now seeing more and more that people have intracellular hypothyroidism. Now, what is that? Well, a lot of people don't realize, for example, that the thyroid gland only makes 20% of the T3. It makes all of the T4, but where the T4 gets converted to T3 is the kicker. So, and all of these are just looking at thyroid status. They're not looking at how well is the T4 taken up into the cell, how active is the deiodinase enzyme converting the T4 to T3, and how much reverse T3 is being made. We now have something that will help enormously in treating thyroidism, hypothyroidism, and that's the free T3 over reverse T3 ratio. It's not the final word yet, but you want it to be about 20-1. And most of the time, even in people that are feeling well, it's going to be lower than that. And of course, they have all the other symptoms that have to do with low-grade hypothyroidism. I'm going to tell you, not quite as many people as have low thyroid as have excess calcium, but a very large number. Okay? And so this will also end up being a ratio that tracks disease well, too. Just like you have reduced vitamin C versus oxidized vitamin C, AA over DHAA, that ratio goes wacky when you get ill. Same thing with the T3 reverse T3 ratio. And talk about that right now. Cellular hypothyroidism and a proper ratio of free T3 to reverse T3. And very much go slow. Go slow, go slow. If you have somebody with established coronary artery disease and you just start them on 2 grains of thyroid a day, you're going to give them a heart attack. So you got to build it up slow, start with a half to a quarter grain for a week or 2 at a time, build up. So, this is important too. Vitamin C does a lot of good things, and it does a lot more good things when you use different forms in optimal doses. Liposome encapsulated, sodium ascorbate powder to bowel tolerance. One does intracellular, other does extracellular, ascorbyl palmitate, fat soluble. All these different ways of optimizing your vitamin C levels. And then whenever you can, of course, IV. Okay, so the recap. Heart arteries never become chronically inflamed and infected without an ongoing source of pathogens or toxins to support the inflammation. The chronic inflammation results in a chronic scurvy of the coronary arteries and initiates a chronic influx of inflammatory and immune cells that then becomes the very disease of atherosclerosis itself. So finally, the heart attack patient might be unlucky, but there's always something there that you can turn the luck around, and it usually involves reestablishing complete dental health. So lessen new toxins, eliminate old, restore hormones, optimize antioxidant levels. And this is where I talk about the interaction. The patient with a root canal treated tooth should be advised to see the physician for cardiac workup. The cardiac patient seeing the physician should be advised to see the dentist for gum and occult tooth infection evaluation and treatment in the event that he doesn't have a root canal. And finally, all dental patients need to have a full informed consent prior to receiving a root canal treated tooth. This is my website, that's my email, and there's a website address over in the other area where, if you want, you can take a picture of it with your phone, and you can download any or all of my 3 most recent books. Thank you.